Up next on Primary Care, exercise. It can make you feel better, look better, and reduce your risk for chronic disease and add years to your life.
Swimming is one of the best exercises because you're exercising your entire body at the same time.
Hello, I'm Dr. Lonnie Joe, and welcome to Primary Care, where each week we address topics related to the health of African Americans. Regular exercise can reduce the risk of chronic disease and produce many positive physical and mental health benefits. Yet despite these benefits, studies show that physical activity is quite low among African Americans. So low that older African American women are among some of the least active in the U.S. Because African Americans are disproportionately affected by chronic disease, promoting physically active lifestyles as an effective means to prevent chronic disease has become a priority for many health professionals. Joining me today to talk about the health benefits of exercise is Dr. Victor Katch. Dr. Katch is a kinesiologist and professor emeritus of movement science, School of Kinesiology at the University of Michigan. He is an author and has published extensively on the science of exercise and nutrition over his 43-year career at the University of Michigan. Dr. Katz, welcome to Primary Care. Thank you so much for joining us.
Thank you for inviting me. It's a pleasure to be here.
Good. Listen, we're all told to exercise. I think everybody knows that. Why isn't the country moving more?
Well, that's a difficult question to answer because it's so multifunctional. We have engineered sedentary living. You know, we want to try to avoid doing things that we don't like doing. A lot of people aren't used to exercising.
Is that a phrase you coined, engineered sedentary living?
I don't think I. Okay. But one of my colleagues coined the term homo sedentarianism, that we have essentially changed over the years to become a very sedentary population. And we engineer it. We have escalators, we have elevators, we have walking places in airports so you can't even walk if you want. You can't even go to a hotel, even here in downtown Detroit, go in and try to find the stairwell to go up 5 flights. They discourage physical activity, and we've done it all the time. So we've become very sedentary. We see it as kids with all the social media and the phones. And all the things that are doing. We don't have people who are afraid to go outdoors now. So we've become essentially a sedentary society. And many people think that's a good thing. You know, you got a big car, you can drive. I know someone who lives in Ann Arbor where I live, goes from his garage down to his mailbox to get his mail and go back up in his car because he doesn't want to walk. And it's not in the winter. It's too much to go up and down the driveway. So we have a big public health problem here where we're not encouraging people and teaching people to move more.
Very interesting observation. Engineered or manufactured, it's real. People will go to the mall and drive around for 30 minutes waiting for a parking space to open up closer to the door. I think lots of people are probably guilty of that. You would not go to the appliance store and buy a television if it didn't have a remote control. I mean, we're not going to get up and go back and forth. So over time, we have turned into this entity.
This sedentary population.
Exactly.
Yeah.
And it's showing the negative results in terms of our health.
It has, and it starts at a very young age in schools. What is the first programs that usually go when they start cutting funding? Physical education.
Mm-hmm.
We think sometimes that physical education is not necessary. It's 3 days a week or 2 days a week or so many hours per week. We have one physical education teacher for several schools. It's a really sad state of affairs, and we need a public health push to get people more active. This is very important. You know, human movement defines humans, sentient beings. Every sentient being moves. When you don't move, you're dead.
Exactly.
So we really need to encourage more movement. In fact, part of the aspect of being alive is trying to be well, is trying to have vitality, some joy, some longevity. And if you look at all the aspects of sort of human wellness that defines who we are, from the physical, emotional, intellectual, interpersonal, environmental, in each of those domains, we can describe very, very well those kinds of activities that we need to do to promote, let's say, interpersonal relationships or to promote healthy bodies. Yet we don't do very well at trying to do that at all. As a matter of fact, we decrease that, or we decrease in each one of these domains. Physical activity, increased human movement, has such a ripple effect in all of these domains of wellness. It cuts across all of those. So if someone were to ask, what is the one thing you can do to improve overall wellness? That's to include all of these aspects of what we would call health, or the new term is wellness now. Physical activity and nutrition are the two things that cut across all of those that have a very ubiquitous effect. And yet we do nothing to promote that. Instead, we promote targeted attacks from pills, from certain treatments to try to make a change. It's easy to do, have a pill. Some people are trying to work on a pill for exercise. You don't need to exercise, just take this
the pill. Yes.
Yeah.
Burn up calories that way.
And that seems to make sense to a lot of people. Well, why couldn't I do that? You know, if I have type 2 diabetes, I can take a pill to make my pancreas produce a little bit more insulin or become more sensitive to the effects of insulin. So why, if we can take a pill for that, why do we need to change our nutrition? Why do we need to change our physical activity? So we've got ourselves in a real dilemma here. And this is a public health issue.
You know, you touched on it a little bit by mentioning the disease state of diabetes, but every part of the body benefits from exercise, no matter what system we're talking about. Tell us a little bit about how that starts with brain function and brain power and actually being able to use, you know, your God-given physical attributes better on a daily basis, all because of exercise.
Well, almost every system of the body, as you know, if you're going to deal with the cardiovascular system, the respiratory system, the nervous system, the endocrine system, all of these are integrated. They don't work and they don't operate independently. So if you do something to the metabolic system, that affects all the other systems. It's the same with mental function and brain function. So we know that there's a very clear distinction now between some of the blood-borne substances that are produced that can go across the blood-brain barrier and affect the brain. They can study it now with these fMRIs and stuff. You can see how that happens. And studies that show that the subtle changes with increased physical activity over a protracted period of time have a direct effect on a lot of the chemicals that affect brain function. For example, just the feelings of joy can be stimulated with a brain chemical. Physical activity has been shown to increase the production of that chemical, so you get a, quote, runner's high, or you feel better. When you ask people who are chronic exercisers, like myself, who are chronic movers, who move all the time, why do you do this? Why do you spend all the time doing all these things? And the number one reason they'll tell you is it makes me feel better. And that speaks legions for everything we do. So in terms of brain function, it starts with the muscle. Muscle affects everything else. You know, we have all these muscles. Our brain is a partly muscle. And so when you increase the metabolic activity of muscle, that has a ripple effect over all the systems of the body.
Not only, since you mentioned the endocrine system, not only has it been proven that you can increase the amount of certain substances that have positive and beneficial effects from exercise, you can improve the quality of those substances as well. And I find it to be very interesting because with what we're saying on the opposite end of that coin is that if you don't exercise, your amount's going to be low and your quality's going to be less. That's a prescription for danger.
It is. Historically, they tried it when they started promoting exercise and physical activity as something beneficial. We always talked about how it stopped some of the negative things. You know, if you exercise, you won't get this, you won't do this, instead of the positive aspects of it. So exercise became, in a way, a negative. Oh, I've got to go exercise because I want my blood to be better, or I want my endocrine system to function better, rather than, oh, geez, it makes me feel better, I can sleep better, you know, I have more restorative strength. Even physical activity is one of the best things you can do prior to going into surgery. Anybody, as you will know, when you treat patients for some chronic disease or even an acute problem, the person that is more physically active, less body fat, they recover faster, sort of like prehab, if you will.
Right.
You know, being physically active acts to promote health, not just stop all the bad stuff.
It's amazing that we don't take more advantage of these kinds of things that we've discovered through diet, exercise, and scientific research. Victor, we're up against a break. Next up on Primary Care, we introduce you to one of our own senior cameramen, Furman Barnes, who learned over the years just how beneficial exercise is to his overall health.
1 in 3 adults has pre-diabetes. That means it could be you, your favorite brother, your other brother,
Yes.
you, your football buddy, your football buddy, you, your plumber,
Breathe right into your foot.
your plumber's masseuse,
Yes.
you, your dog walker, your cat jogger. With early diagnosis, pre-diabetes can be reversed. Take the risk test at doihaveprediabetes.org.
After being told he was a diabetic, it took Mr. Barnes years of falling off and getting back on the wagon before he became consistent with his diet and exercise program.
My name is Furman Barnes. I'm 66 years old. I'm a diabetic. I've been a diabetic for a little bit over 20 years, maybe about 23 or so years. I found out when I went in just for a typical checkup, and they thought that my sugar was high, and so they wanted to put me on metformin, and they had me come back in 2 weeks. So during that time period, I decided to just study it on my own. Just did a little research about diabetes, and basically it said watch what you eat, especially your carbs. Try to keep away from sugars and stuff, and to basically change your diet and exercise. So within that 2 weeks, that's what I did. And I came back and they wanted to know, what did I do? Because everything was normal. And they said, what did you do? I said, well, I just did a little research and I just made some changes. And so they still wanted me to take metformin and stuff, which I didn't do. I just exercised and ate a little bit differently and stuff. It took over several years for me to reach the point where I am now, because I was going up and down. But now I'm working out, 5 days a week with my son and grandson, or grandsons, sons at time. And that's probably been more responsible, because it's become kind of a family thing. I want to go so I could be with the kids, you know, that type of thing. The fatherly thing to do. When I'm not really busy, I try to swim like a couple of times a week also. I try to get that in. I like swimming. You know, I figure that's good for the heart. And they say swimming is one of the best exercises because you're exercising your entire body at the same time. I eat more plant-based. For a while there, I was completely plant-based for several months. And so I still eat mostly plant-based diet now. a little bit of chicken, sometimes some beef. And kept working out every day. Like 3 o'clock, usually my son texts me and says, "Jim," with a question mark. And I text him, "Yeah, I'll be there." And it's worked. And probably at this point, my best incentive is getting compliments every now and then from the fair sex. So I don't mind that. So something must be working.
Dr. Katch, Mr. Barnes is able to manage his diabetes with exercise and diet. Can you talk a little bit about exercise versus diet in terms of a diabetic actually getting to target, getting to goal?
Well, they're obviously both very important for different reasons. But I had a friend of mine and I wrote an article once that I said, you can't outrun your diet. So if you want to put a judgment on which is more important or less important in terms of what Mr. Barnes was talking about, diet's probably more important. But that's not a fair thing to say because they both are synergistic. They work together. You never go on, if you're a diabetic, you should never go on an exercise program without changing your diet. And I really applaud him for being a plant-based eater. In the weight control clinic, we had hundreds of people who were type 2 diabetics in the same condition, and we immediately put them on a plant-based diet, showed them how to cook, discussed about foods, and automatically instituted a physical activity program. The whole idea here is to move more, sit less, and eat a more plant-based diet. And you can almost reverse type 2 diabetes this way. You can get off almost all medications. Now, it may take 6 weeks to 3 months. For those that are responders, there are some that are non-responders. Maybe 10 or 15% don't respond, and they may need some medications. So it's not surprising that he's modulating his blood sugar. He's improving his type 2 diabetes, not just the blood sugar, but the sensitivity to the effects of insulin. So his pancreas is producing a little bit more insulin. Fatty liver is going down a little bit. And that's what he's talking about here is the recipe for success. To move more, sit less, and change your diet.
Right. As it relates to the plant-based diet, we've seen people who have progressed to the stages, through the stages of renal disease from diabetes, and we've been able to arrest the decrease in the GFR, slow down the progression, hold it right there just by having them become vegetarians, eat strictly a plant-based diet, and say, boy, your progression to dialysis in the United States is slowing down, or you're holding the line in terms of how fast you're going, because we can go back and document the progress to renal failure, and we've been able to make that intervention and say, wait a minute, we're buying some time, hopefully, or maybe we're going to sit here for years to come just by changing the diet.
Well, it's surprising you say that. I must admit that I am that person.
Get out of here.
Yeah, so I have chronic kidney disease. I'm stage 3.5. And I've been a plant-based eater for almost 32 years now. My estimated GFR is holding stable. And it's not decreased at all. So it's almost stable now. Along with physical activity, and I've argued with my renal doctor about, I've looked at their diets, the renal diet, and said it's horrible.
It's terrible.
It's just, I can't believe that we would put people on this, and I looked at that.
People don't follow it.
No, I said, I'm not going to do this, you got to be crazy. And there has been just recently a rather large study showing that a plant-based diet does exactly what you say. So I don't believe in testimonial evidence. I don't think that's good scientific evidence. But what you're saying is documented in the literature, and I'm sort of the poster boy for that at my age for the last over 30 years.
Victor, people are going to think we made this up for the show.
No, we didn't make it
I'm
up.
sitting here totally blindsided by your testimonial, so to speak, okay, in doing this. But we've proven, my clinic, my partners and I, we've proven with certain patients that we can actually decrease, if nothing else, the progression
Yes.
the decrease in the GFR in patients.
Yes, you
by doing
can, and you can change a whole lot of variables just by going on that plant-based diet. It's a bonus if you increase your physical activity as well, because they complement each other so much that it's a perfect thing, and you don't have to look at numbers and all these other things. That if you do that, if you do the best you can, it's hard for some people. Now that's the way I live, so it's not hard for me at all. I grew up with a Polish mother feeding me goulash and all that other stuff, and by the time I got to college, I realized, time out, this isn't good. And I started switching over to being a more plant-based diet. Now this is in vogue.
Right.
Now it's part of our whole culture to understand more about a plant-based diet. And I think it's a wonderful thing.
Amazing.
I just, in January, in my Health Yourself article, I am just talking about that exact same thing, and it's the first time that I've ever told anybody. I didn't know you were going to ask me this,
Breaking
and this
news.
came up. Well,
Right here on
but
Primary
you just
Care.
said that,
Right.
and I just said, whoa, that's who you're talking about.
How about that? That's
Yeah.
amazing. We're up against another break. We'll be right back with more Primary Care and Dr. Victor Katch.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. We're here with kinesiologist Dr. Victor Katch. Victor, the disproportionate share of a lot of disease states is borne on the back of African Americans. This obesity thing, we're finding that 60% of African American women are obese. 50% of young middle school, high school black girls are obese. We're missing the mark here.
Right, and a lot of this has to do with regional areas in inner cities, so it's a poverty issue where there's not enough resources going into the public schools to encourage physical activity. The teachers are unqualified to teach physical activity or know about it, to integrate it within the whole school system of what they do. You know, it's very possible to teach mathematics through physical activity.
Exactly.
Same with nutrition.
Right.
That we ought to be teaching our young folks to do this. And this is particularly true in inner city, in poverty areas, and underserved minority populations, where it's a double whammy. There's no public transportation or poor public transportation. There's no after-school programs. There's no preschool programs. And then someone says they cut all the funding for physical activity, they do these, and then they look, oh my God, look how fat you've gotten. We've got to do something about this. Something has to be done from the top down to get more funding, more education in our colleges and public education institutions to train people to know more about this.
So we see also with exercise and other diseases like hypertension, you know, we touched earlier on the Jackson Heart study, okay?
Right.
And how the benefits of exercise actually improve the outcomes in terms of hypertension. You know, we're just getting to about 50% control rates of high blood pressure in this country, which the University of Michigan, I don't know many classes you pass scoring 50%, but here again, in essence, we're failing as a society in incorporating exercise into disease states.
Yeah, and we know this because there's been research studies in exercise physiology and health parameters and health outcomes that have been going on since the 1940s, believe it or not, that show that increased physical activity reduces hypertension clearly, as well as changing nutritional foods you eat. You can have a remarkable effect on reducing hypertension, reducing all kinds of maladies.
Including the mental health benefits of
Yes.
exercise.
Yes, people feel better when they exercise. There was just a recent study published on looking at medication versus physical activity on depression. Physical activity did better. More people reported better outcomes than medication. That doesn't cost anything.
How about that? A little inspiration
Yep.
could go a long way in this area.
Perspiration.
Yeah, a little perspiration could go a long way. Victor, this has been outstanding. We're so happy to have you with us today. Let's do this again.
Thank you very
for joining
much.
us.
I appreciate it.
Great.
Yeah.
Our guest has been Dr. Victor Katch, Professor Emeritus of Movement Science, School of Kinesiology at the University of Michigan. Physical activity doesn't have to be strenuous. It doesn't have to be strenuous to the point that it makes you painful, okay? There are lots of benefits to being active, okay? Men and women of all ages and racial backgrounds benefit from a moderate amount of daily physical activity. Men over the age of 40 and women over the age of 50 who plan to start a program and a vigorous activity should consult their physician to be sure that they do not have heart disease or other health problems that would interfere with an exercise program. And adults with chronic health problems such as hypertension, diabetes, and/or obesity, for these conditions should consult their doctor before beginning any exercise program. Thank you for watching. For Primary Care, I'm Dr. Lonnie Joe.